A cardiac tumor is an abnormal growth of tissue within the heart. These tumors can be classified into two main categories: primary and secondary tumors. Primary cardiac tumors originate in the heart. They are quite rare. Secondary cardiac tumors, also known as metastatic tumors, originate in another part of the body and spread to the heart. They are more common than primary cardiac tumors. They're most commonly metastasized from other cancers, such as lung cancer, lymphoma, or cancer of the lymphatic system, breast cancer, leukemia or blood cell cancer, melanoma or skin cancer, liver cancer or hepatocellular carcinoma, and colon cancer. These tumors typically spread to the heart through the lymphatic system, affecting the pericardium. This can cause pericarditis, which is inflammation of the pericardium, and pericardial effusion or fluid buildup in the pericardial cavity. While it's less common, cancer can also spread to the myocardium through the bloodstream. Primary cardiac tumors are rare, but when they do occur in adults, the most common type is myxomas. Myxomas are benign tumors, meaning they are non-cancerous. These tumors originate from the mesenchymal connective tissue within the heart. In an adult, the heart is fully developed and myocytes are permanent, and they don't proliferate. Most myxomas are found in the left atrium of the heart. They are pedunculated, meaning they are attached to the heart by a stalk of tissue. It's like a gelatinous mass on a stick. It can grow and block blood flow from the left atrium to the left ventricle through the mitral valve. This blockage can decrease blood flow to the brain, causing fainting. It can also lead to a buildup of blood in the lungs, causing dyspnea and fluid buildup in the lungs or pulmonary edema. If the blockage occurs on the right side of the heart or tricuspid valve, it can cause right heart failure, leading to symptoms like jugular vein distension, hepatosplenomegaly, and edema. Additionally, small pieces of the myxoma can break off and travel through the bloodstream, potentially causing an embolism, which can block an artery. If this occurs on the right side of the heart, it can lead to a pulmonary embolism, causing shortness of breath and chest pain. If it occurs on the left side, it can lead to a stroke or arterial embolism in the extremities. Both valvular obstruction and embolisms can potentially cause sudden cardiac death. Myxomas can also interfere with the heart's electrical signals, causing abnormal rhythms like atrial fibrillation, which may be felt as palpitations. However, some individuals with cardiac myxomas may be completely asymptomatic. Echocardiogram is the most common and effective way to visualize the myxoma. Surgical removal of the myxoma is typically curative. The most common primary cardiac tumor in infants and children is rhabdomyosarcoma. These benign tumors usually affect the ventricles and are best considered hamartomas rather than true neoplasms. Hamartomas result from the abnormal formation of normal tissue. These developmental masses also frequently occur in children with tuberous sclerosis, a genetic disorder that causes non-cancerous masses to form in various tissues. This condition is due to mutations in the TSC1 or TSC2 tumor suppressor genes, which normally suppress tumor growth. Thus, mutations lead to myocyte overgrowth. Most rhabdomyosarcomas regress spontaneously. However, if they cause symptoms such as obstructing a valve or the outflow of blood from the heart, surgical removal may be necessary.